Guys, how are you doing? I hope you are doing well. It's been a while since I posted a video, but I am back. So today I want us to remind ourselves about breast cancer. Yes, because it's becoming so common amongst women. So I want us to have a few hints, or I want us to understand what is breast cancer and the symptoms, so that we can be vigilant. We cannot, so that we don't be ignorant. Anytime you see a symptom or a suggesting clinical feature, you go to the hospital for a checkup. Okay. So I want to start by defining breast cancer. Normally, a breast has cells, normal cells. So the normal cells of a breast are produced within a set time, and they die after a while. So, but when we talk about breast cancer, this is when now we have abnormal cells in the breast. These abnormal cells, they produce so fast, and then they don't die. So when they don't die, they accumulate together and form a lump or a mass, and this is what is called a tumor or a cancer. So this cancer or these tumors, if left untreated, they become invasive. They spread throughout the body, and they become fatal. So that means breast cancer kills. But if when it is detected early and you are treated early, there are chances of survival. Okay. Yeah. So breast cancer occurs in both genders, that is male and female, though it's most common in female. So in female, the ratio is 1:8. 1 out of 8 women are likely to get a breast cancer. In male, 1 in 1,000 men are likely to get breast cancer. So you see, the fact that you are a female, you have high chances of getting a breast cancer. That's why I decided to enlighten ourselves about this cancer, so that we can know the signs and symptoms. Everybody needs to understand the signs and symptoms of a breast cancer, so that we can seek medical attention early when it is treatable. Okay. So what are the signs of breast cancer? Number 1, a breast lump. This is the first sign you will notice when you have a cancer. A breast lump is a thickening that feels different from the surrounding tissue. How will you know that you have a breast lump? Through screening, number 1. Number 2, through breast exams. So screening is when you decide to go to the hospital, to the healthcare facility, so that a doctor can screen your breast. Number 2, breast self-exams. This is when you, as an individual, you normalize checking your breast for any abnormality. I will do another video to show you how to do a self-breast exam at home. It is so simple, so that you can notice when there is an abnormality, because a lump is something you can feel by touching. Number 2, we have a change in size and shape of your breast. By this, what I mean is, you have to understand your normal breast for you to know when there are changes. So this kind of changes are like breast size. the breast that is affected, it can be small, it can be becoming small or large in size. We can have something like a nipple inversion. This is another sign of a breast cancer. We can have another one, is appearance of your breast. You need to understand the normal breast. How does your breast appear when it is normal? For you to know or to notice when there is a change in the appearance of your breast. This is something like a nipple inversion, or hyperpigmentation, or skin redness, or skin discharge, or nipple discharge. Number 3, we have a newly inverted nipple. You understand how the normal nipple looks like. So whenever you notice that one of your nipples, so you have to understand how your normal nipple looks like for you to notice when it starts to invert to the inward. Number 4, we have breast pain. We have nipple discharge. A nipple should not discharge anything unless you are breastfeeding. So any other discharge that is bloodish or pus-like, that is a red flag. You need to seek medical attention. We have hyperpigmentation of the skin. The skin might start turning blackish or reddish in color. Those are some of the symptoms. Those are the most common ones when a breast has got a cancer. What are the risk factors of getting breast cancer? Number 1, we have inherited genes. This means it can run in families. It runs in families, meaning if your mommy if your mommy has ever had a breast cancer, you are at a risk of also getting breast cancer, though it does not necessarily mean that you will have breast cancer, but you are at a risk. Number 2, we have being female. The fact that you are a female, you are at a risk. As I told you earlier, 1 out of 8 women are most likely to get breast cancer. Increasing age. As you age, as you grow old, you are at a risk of getting breast cancer. Being overweight, exposure to radiation at an early age, alcohol intake, hormone therapy. These are some of the family planning methods that we use as female. The one that has estrogen and progesterone, these are the combined oral contraceptives. Those who like using them, be warned, they predispose someone to breast cancer. Another thing is having never breastfed. So what do we need to do as women? Normalize doing breast exam. Either in the hospital, you can choose to go to the hospital for a checkup. The doctor will help you, will screen your breast. Or you can do a self-exam at home. Number 2, avoid alcohol. Maintain a healthy weight. Avoid postmenopausal hormone therapy. These are the meds that women take when they get to reach their menopause. Some women experience extreme symptoms of menopause, like very high temperatures. So they decide to use meds to try and curb those extreme symptoms. These medications are called postmenopausal hormonal therapy. They have been linked to breast cancer. Another thing we need to do is normalize doing mammograms. Mammograms are imaging techniques that are used to detect when someone has a breast cancer. Okay, yeah, so that is a simple info about breast cancer. So please be on the lookout. Understand your normal breast, so that anytime there's a slight change, seek medical attention early when you can be helped. So it's okay for you to go to the hospital for a checkup. Also, you must not wait for you to experience the above symptoms for you to go for a checkup. Normalize just doing breast checkups, so that just in case when you have an abnormality, it can be detected early when it is able to be treated. Okay, so in my next video, I'm going to show you how to do a self breast exam at home, so that you can know it's just a 5-minute thing that you need to do in your house, that will help you to understand your breast and to notice when you have a lump or a mass inside your breast that is abnormal, for you to seek medical attention early.